Hi. Hi everybody, Dr. Baumholtz and Nurse Celeste, and we're going to talk a little bit about injections, where we typically put them, and where we would like to see people not put them, frankly. So to begin, why don't you give an overview of where we put Botox and where we put filler typically?
Sure. So typically Botox goes on the forehead, eyebrow area, and crow's feet. Filler, we start tear troughs, cheeks, lips, and nasolabial marionette lines.
Awesome. One of the things that I see when I look at my Instagram feed is people that get filler placed in places that I think are frankly dangerous. And even a little bit of research with Dr. Google on vascular events with filler will show that there are certain parts of the face specifically that should not receive filler. So for example, I think putting filler along the jawline where there's some large blood vessels here, the facial artery and vein. I think putting filler in the area between the eyebrows, which is typically reserved for Botox, is dangerous. And certainly as we go to put filler around the mouth when we do lips and other areas, we are going to talk about some risks that there exist to getting filler into the blood vessels. Now these are very rare risks, but the risk is not zero. Lastly, we get a lot of requests for liquid rhinoplasty, and I think if we're going to put some filler, it would have to be below the level of where what we call the medial canthus, or where the eyes sort of sit, and certainly in the midline, off to the side, and you're really asking for some increased risk with where the blood vessels go and connect, because in this triangular area of the center face, there are no valves in the vessels, which can lead to filler sort of getting back into the visual system and even causing blindness in very, very rare situations. Well, that's a brief overview of our philosophy about where we put filler and how we keep you safe. Certainly there are things on Instagram and social media that people have gotten away with. It doesn't necessarily mean that it's the right thing or something that we're going to recommend. Well, I hope that answers some of the questions, and you guys be great, and we look forward to seeing you here at Baumholtz Plastic Surgery. Bye.